Hi, Austin. So nice to see you today. And I'm Ray Carpenter, Dr. Carpenter, prosthodontist. Dr. Mike Singer here, and I joined our practices a few months ago, and we're just really pleased to be working with you. And just for those who don't know, I thought about signing up with Austin probably 3-4 years ago. And just kind of procrastinate a little bit, and then finally about 1.5 years ago, I think it was, wasn't it?
Yeah.
We got together, and it's been incredible. It's just been amazing. So then when Dr. Singer came on board, we joined up together and expanded our outreach a little bit to a few more general dentists, and so I'm really happy. I think this is a real effective way of marketing, particularly for prosthodontists. So yeah.
What sort of results did you get before Dr. Singer was here, when it was just your solo prosthodontic practice, in terms of referral relationships and actual new patients?
You know, I'm not the best at keeping track of all that stuff, so but I did, certainly in terms of referral base, I started getting referrals from people that I hadn't gotten anybody from previously, people I didn't even know, so that was nice. And we got quite a few new patients, and like I said, I'm not really good at keeping track of it, but we got enough new patients that I could correlate, the what we were doing with you, and it certainly made it worthwhile to continue. So.
And I know when Dr. Singer came on, we've been through a transition process of, introducing him to the community. Some people already know him, but then we expanded the mailing list. Dr. Singer, what's happened since you started to be part of the practice?
Yeah, well, just as Dr. Carpenter said, I've known about you, Austin, for a couple of years, and before I signed up, I wanted to make sure that I understood where I was going to be, because I'd moved around a couple of places. But once I found the place that I was going to be here, merging with Dr. Carpenter, I knew that the person I wanted to craft all the practice transition verbiage was you, Austin, because it has been extremely effective. We've heard from not just our new referral sources, but actually some of our referral sources that we both have had mutually.
And we've had good comments from a lot of people.
They appreciated the way things were worded. They appreciated that it was cordial and professional, but also relatable.
I think they like seeing the cases.
Yeah, they do.
I think it's fun for them to see the cases, and it gives them an idea of what we do.
Yeah.
So.
And we've extended our reach, to 25-30 miles away from our practice, and we're in a pretty competitive metro area here in San Diego. So I think I've heard several comments from GPs and from specialists about how they appreciate knowing what it is that we do, and how they don't have to do the same things that we do, but they can use us as part of their team. And it's really informing, I think, everyone what we do here as prosthodontists, and why we do it, and how much we love it, and how much we can help them, both as GPs and other specialists, to get the outcomes for their patients that they really want.
Any other words, or how this compares to other forms of advertising you've done as we close?
So from my perspective, your technique is the only one that has really reached out to real referring dentists. I've gone to the general public before, and that has been effective as well, but you get a different kind of a patient. You don't get the same kind of a prepared, ready-to-go kind of a patient that you normally get from a referring dentist. So that's, I think that's a really big advantage to doing things the way you're doing it.
Yeah, with the acceptance rates and the types of treatments they want.
Right.
Yeah, we call those, actually, we have 2 different names for different types of referrals. If a referral comes from the general public, it's a new patient. But if a referral comes from a general dentist or a specialist directly referred to us, we actually call that patient a qualified patient, because the treatment acceptance rates are significantly higher. The level of treatment they accept is significantly higher, and the revenue that our business earns is higher, because it's also the type of work that we really want to do as prosthodontists. You know, full mouth cases, anterior aesthetics, dentures, implant supported fixed prostheses and removable prostheses, really kind of what we signed up for. So yeah,
Thank you.
you bet.